afternoon, everyone. I'm Brent Roussin, Chief Provincial Public Health Officer for Manitoba. We're continuing to see an increased number of COVID-19 case numbers. Since Monday, we've reported 1,772 new cases. And so this has increased the demand for testing, which has in turn increased the wait time for both at the test collection sites as well as the wait times to receive a test result. So we still have that backlog. We have about 10,700 cases still in that backlog. So the numbers we report are definitely an underestimate of the amount of transmission that we're seeing right now. And so we have been deploying rapid antigen tests at several of the COVID testing sites over the last several days. This is going to be expanded over the next couple of days throughout the province. And only those that have that positive test on the rapid test will return for the PCR. And so this will help with that backlog, help with some of those wait times. And again, the result of that is our test positivity is going to be higher than what we would normally compare it with, just because we're screening out a lot of people who would have tested negative on that PCR. So, again, we all need to do what we can to reduce the spread of the virus, to reduce some of that demand on the testing sites. So certainly only symptomatic Manitobans should be going to these test sites. Things for travel purposes or just asymptomatic testing, that's going to need to be at places other than our test sites. We've talked about before, if you're young and healthy, under age 40, don't have any other medical problems, then you should consider that you very likely have Omicron, and that you can stay home, isolate for 10 days. You should notify any close contacts you may have. You should have your household as well isolate in that instance, and this will help with reducing some of that demand, but at the same time keeping us safe. Of course, people working in those critical sectors where it's important to rule out whether they have an infection or not should still be attending for testing, even if you're in that lower risk group. So we have public health orders in place to limit the number of people at private and public gatherings. Manitobans are going to need to once again reconsider their plans over this holiday season. New Year's is coming, and we need to do whatever we can to decrease the amount of contacts we have during these next number of weeks. So we know that Omicron is going to have an impact on our healthcare system. We can see other jurisdictions, the amount of admissions increasing over time as case numbers increase, and that's going to occur here too. So we need to be prepared for that. We need to reduce the amount of contacts we have quite significantly in order to protect the healthcare system. And so those are things that we've been unfortunately quite accustomed to over the last couple of years, and that is staying home as much as possible, reducing those close contacts, for sure staying home when you're ill. So again, like we reiterated, we're doing a lot of testing and getting a lot of test positives, but we're having difficulty reaching a fairly significant amount of people with their test positives. And so really we want that messaging. If you are symptomatic and going for a test, well, you should be isolating. So when we call homes with positive results, people should be at home isolating. We shouldn't really have any difficulties reaching people because we need those people isolating. So again, we urge you to stay home for 10 days if you're symptomatic and don't have and are not going for testing. When you do go for testing, we have to expect some of those longer lineups, although some of this rapid testing, some of this messaging is going to try to help with that. We also need to wait for that test result. And that turnaround time is 4 days, sometimes longer. And so that means if you are symptomatic, if you are ill and needed testing, even if that's taking 4 or 5 days to get a result back, you should be isolating that entire time. No one wants to hear this. No one wants to hear case numbers going up. yet again in a holiday season. So please be patient with other Manitobans, with the staff at the testing sites, with public health if they're reaching out to you. These are difficult times for all Manitobans. And so we do have things, again, that we can do to reduce the spread of this virus. The fundamentals we have spoken about so much. Limit your contact with others. Stay home when you're sick. Stay home and isolate while your results are pending. If you're not going to go for testing, stay home for that 10 days. Wear a well-fitted mask, wash your hands, cover cough, and of course get vaccinated. For whatever dose you are eligible for, get vaccinated as soon as possible. We thank all Manitobans who are stepping up. We know it's really challenging times. And again, thank you to our healthcare providers who are again at the front lines of surging case numbers. So thanks. I'm going to turn things over to Dr. Reimer.
Thank you, Dr. Roussin. Good afternoon. I'm Dr. Joss Reimer, medical lead on the province's vaccine implementation task force. I'd like to provide a brief update on vaccine uptake in Manitoba. As of today, 89.5% of Manitobans over the age of 18 are fully immunized. This represents 2,441,833 doses being administered since the vaccine campaign began. More than 234,000 Manitobans have also received their third dose of a COVID-19 vaccine. A few key points to note on eligibility for third doses. All adults aged 18 or older who are 6 months after their second dose can receive a third dose of the COVID-19 vaccine. These are available at any location that offers the vaccine. In response to the rapidly increasing transmission of Omicron, however, the timeline between second and third doses has been shortened for some individuals. So that's anyone who is age 50 or older, or those who are aged 18 or older and live in a First Nations community, who received their second dose at least 5 months ago. These individuals are now strongly encouraged to receive their third dose as soon as possible. The 6-month timeframe between second and third doses continues to be recommended for most other Manitobans. Individuals who are moderately or severely immunocompromised or have travel plans to a destination that only accepts certain vaccines or a specific combination of vaccines still require a prescription to receive their third dose earlier than 6 months or earlier than 5 months if they meet the criteria noted earlier. So this approach is not based on an increased risk related to travel generally. It's also not based on travel to any specific destinations. So for clarity, what we're saying is if you have doses of the same mRNA vaccine, it is extremely unlikely that you would require a third dose regardless of your travel destination. And those people who are getting a third dose should be getting it because their destination requires it for entry. One new thing that I want to share with Manitobans today is that public health officials now advise that for individuals who are age 30 and older, the Moderna vaccine should be the preferred choice. So keeping sufficient stock of the Pfizer vaccine available to adolescents and young adults will minimize the risk of myocarditis and pericarditis for this younger age group, while maximizing the benefit for all of us, including those who are over the age of 30. However, if individuals feel strongly that they do not want to take Moderna, Pfizer can still be provided at their appointment. Both Moderna and Pfizer are safe and effective, and either of them can be used for adults in Manitoba. This means if the preferred product is not available, either mRNA product can be offered to adults and their vaccine should not be delayed. I want to be very clear on this point though. This is still consistent with our approach throughout the vaccine campaign. Our advice remains that where possible, we recommend that people stick with the same mRNA product for all of their doses, the only exception being that we recommend Pfizer for doses for those people under 30. However, When that product is not readily available, such as what we're seeing potentially with Pfizer going forward, either mRNA product can be used and vaccination should not be delayed. So that means currently, with our estimates for inventory and our future planning demonstrating that our Pfizer supply may be constrained going forward, this does require us to change our current approach. This change is done to protect Pfizer supply for young people who are at risk of myocarditis, while still offering a safe and effective, possibly even more effective in some situations, mRNA vaccine, that is Moderna, to those who are not at an increased risk of myocarditis, and that's people over the age of 30. For children who are age 5 to 11, parents and caregivers can make first and second dose appointments for eligible children online by calling the provincial call center, visiting your doctor's office, or contacting a local pharmacy for an appointment. Children must be 5 years old at the time the appointment for the first dose is booked, and the interval between first and second doses remains a minimum of 8 weeks overall, or 21 days for children living in First Nations communities. I also wanted to use a little bit of time today to review the guidance for people who are immunocompromised. NACI, or the National Advisory Committee on Immunization, recommend that a fourth COVID-19 vaccine dose be received by individuals who had a 3-dose series due to their compromised immune response. So if you are moderately or severely immunocompromised, and because of that you received 3 doses instead of 2 doses for your initial series, it is recommended that you should receive a booster dose just like everyone else at least 6 months after your last dose. The difference for you is that this will be a 4th dose, whereas for other people who are not immunocompromised, this is their 3rd dose. Those who are eligible for a 4th dose because they received 3 doses in their original series include people who are receiving chemotherapy treatments for cancer, those who received an organ donation and are now receiving medication or other immunosuppressive therapies, people who were born with a severe dysfunction of their immune system, people living with untreated or advanced HIV, people who are taking medications that can affect their immune system. Additionally, if you are receiving hemodialysis or peritoneal dialysis, for a solid organ transplant, or you have a ventricular assist device, you should talk to your doctor about whether or not a 3-dose primary series followed by a 4th booster dose makes sense for you. Some Manitobans may have questions about why they should get another dose if they're already considered fully immunized after 2 doses of an approved COVID-19 vaccine. I'll start by saying that we are always learning more about the effectiveness of the vaccine against this virus and all of its variants. The vaccines and the virus are both the subject of intense research by scientists around the world. How long the protection lasts after vaccination and when it's appropriate to revaccinate can only be determined after a certain period of time by monitoring the vaccines in the real world. This applies to all vaccinations, not just COVID-19. Usually it takes several years to set up the best vaccination schedule possible. In a pandemic, however, we don't have years to wait. We need to boost immunity and protection as soon as we possibly can. Since the launch of the COVID-19 vaccine, studies have been conducted around the world. The results from some of these studies show that by the 6-month mark after your 2nd dose, the effectiveness of protection decreases, and therefore the likelihood of a breakthrough infection increases. And this likelihood has been greatly increased by the emergence and spread of the Omicron variant. This variant at the time of the initial development of the vaccine. And this variant has been able to partially bypass some of the protective mechanisms established by the vaccine to cause an initial infection. Other studies point to the risk that protection declines more quickly after vaccination in older people, in particular those over 80, and in those with a weakened immune system or multiple chronic illnesses. Again, this is not unusual. This phenomenon is observed with other vaccinations against other diseases as well. But in order to prevent an increase in breakthrough infections, especially in people in high-risk groups, such as those who are immunocompromised, who are chronically ill, or elderly, it is advised to vaccinate these groups with a booster dose to strengthen the protection against COVID-19. You may be wondering how well the booster vaccine protects against new coronavirus variants such as Omicron, which is now the dominant strain we're seeing in Manitoba. Vaccination remains the most effective way to reduce the spread of COVID-19 in Manitoba and to protect the health of as many people as possible. We have one study from the UK that showed that a booster dose increased protection against infection with Omicron from 35% up to 70%. But we still need much more data to truly understand the risks of this new variant. What we can say is that regardless of how well the vaccine works or doesn't work at preventing infection, all of the studies continue to show that it works well to prevent hospitalization and ICU admission. The UK, for example, is still seeing over 90% protection against these severe outcomes. There is no other measure that offers that same level of protection as the vaccine does, particularly once you have your booster. We're hearing a lot about how this pandemic will end, by what means, and questions remain about whether vaccination will be a means to end this pandemic. According to the results of studies, protection against the COVID-19 disease after vaccination does decrease over time. And so it will be necessary to use booster doses, particularly in people at increased risk, to maintain the highest possible level of protection. It's not uncommon to administer multiple doses of a vaccine to provide sufficient protection against other infectious diseases. For example, tick-borne encephalitis. That vaccine consists of 3 doses in the first year, and then regular revaccination at intervals of 3 to 5 years after that. Influenza vaccines are given every year, with vaccines being modified according to the currently circulating strains of the influenza virus, making them as effective as possible. The most effective long-term vaccine schedule for COVID-19 is still under investigation. Many scientific studies will need to be carried out to determine whether a 3rd dose alone will be sufficient or whether additional doses of vaccine will be needed. We still need to learn a lot more about the development of all of the different parts of the immune response in vaccinated people, and these will need to be carefully monitored over time. Of course, for the COVID-19 vaccine to have any role in the end of restrictions, as many Manitobans as possible need to be vaccinated. According to current data, vaccinated people are still less likely to become infected, even with Omicron, although this protection has significantly decreased against the infection. The data also shows that people who are vaccinated, if they are infected, are less likely to infect someone else than someone who is not vaccinated and gets an infection. Studies have shown, for example, that the amount of virus present in a vaccinated infected person decreases much faster than it does in an infected person who has not been vaccinated. As the number of confirmed COVID cases is still rapidly rising in Manitoba, it is necessary to do everything we possibly can to protect the most vulnerable groups in our communities. These are mainly elderly people, people with immune-compromising conditions, but also with various chronic diseases. So I thank each and every one of you for doing your part to take care of yourselves, each other, and your communities. I recognize that this long pandemic is wearisome. I am tired, you are tired, We are all tired of hearing about the importance of vaccination and about hearing about this virus. But this is one proven effective thing that we can do, that we do have control over. So doing this, getting your vaccine, along with following all of the public health guidance that Dr. Roussin just mentioned, reducing your close contacts, wearing a mask, hand hygiene, staying home when you're sick, all of these things will help us as a community to get closer to the end of the pandemic. Vaccination is something that is within our control to do. It is safe, and it will be much more effective than being unvaccinated. It will help us reduce the number of people in the testing lines, and more importantly, reduce the number of people in our hospitals and our ICUs. So thank you to all Manitobans for everything that you're doing so far, and we can now go to questions.
Thank you, doctors. A reminder to our reporters on this session, you will have one preliminary and one follow-up question to begin. Up first this afternoon from CBC Radio Canada, Simon.
Hi. So the first question is for Dr. Reimer. How is the vaccination campaign for the 5 to 11 years old? There was a call from the Minister of Education to get the kids vaccinated during the holidays. So how is it going?
We saw a really great and steady increase in uptake amongst 5 to 11-year-olds. We've hit just about 50% of that population being immunized. Certainly over the holidays, that has slowed down significantly, but that's likely due to the fact that schools were not open, and so we weren't able to offer our school vaccine clinics like we normally would do. So we do expect that once schools resume and our vaccine clinics are able to run in the schools again, that those numbers will start to pick up again, because we still have not visited even half of all of the schools in the province. And so there's still a lot of room for us to reach more kids in this age group.
And the second question is related to the numbers on the COVID cases related to the vaccine. Is it confusing for some people that many vaccinated people are being infected with the COVID-19 at the moment?
I would say it's absolutely confusing. We're definitely seeing that 2 doses of the vaccine given months in the past is not working as well at preventing infection. But I want Manitobans to know that this vaccine is still very effective at preventing those severe outcomes. And that's really the goal. You know, we wouldn't be doing all of these public health orders and all of these different interventions for a mild disease. We do this because our hospitals are full. And if they continue to grow in the number of patients in those hospitals, it becomes very challenging to provide care to Manitobans, regardless of why they're there. So while it's clear that more vaccinated people are at risk of becoming infected, they're still less likely to spread to other people. And most importantly, much less likely to become severely ill and require services of a hospital or an ICU. And that's really critical. We want to prevent deaths. We want to prevent severe outcomes. We want to protect our healthcare system.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. You have people, freezing in line outside of the testing site at the U of M this morning. Long lines of cars again. When will more swab capacity be added in Winnipeg?
Well, we've kind of addressed that in our in the opening message there, where we're increasing the capacity by distributing the rapid tests. Remember, right now there's a lot of strain in the system everywhere. We have a strain in the acute care system. We have a strain at the testing sites. So the capacity is just it's very tough to come by, because all aspects of our systems are strained right now. So we've addressed it by trying to decrease those wait times by having the rapid tests available. We've also messaged now, if you're needing a test for purposes other than being symptomatic, then we don't need those people coming to those sites now. And then again, if you're young, if you're healthy, if you don't need to know one way or the other whether you're positive because of your occupation, then those people can also just be at home and isolate. So a number of things have been undertaken, and we're working on getting even more of those rapid tests out, which should help alleviate things even more.
Okay, Dr. Roussin, we have, anecdotal reports now of increased people in healthcare calling in sick. We already had kind of tenuous capacity at ICUs. When you do the math, even if almost 25% as severe as Delta, we have immense numbers lately. You do the math, and we're going to have way more people in ICU in a few weeks. Can you explain why you haven't locked down? And I know you're going to tell me you try to choose the least restrictive, but why not act now before our ICUs fill up, even be further than they are?
So this is what we've been discussing, is that Omicron, a lot of early reports do show that it's probably less severe, but we can't rely on that just because of those sheer numbers. So we have taken a number of steps. We've done a lot of restrictions right now, and I'm sure there'll be questions here on regarding how difficult the restrictions we have in place are on other sectors. So lockdowns take various forms, and we do have quite a substantial lockdown on the unvaccinated. We've had that for quite some time. And we have quite significant restrictions on other places. So we may need to do more. We need to be prepared for that. But if I look and compare with many other jurisdictions, we've taken very closely aligned steps. And day by day, we are watching these things.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. Is Manitoba considering modifying the isolation period for infected people from 10 days to 5 days, as the CDC has recommended, and why or why not?
Yeah, we're definitely looking at that, looking at reducing the what we define as the isolation period, both for people who are test positive and also who are named as contacts. And it's all, again, about that risk, right? So the shorter that period, we have the benefit of people getting out of isolation sooner, maybe more likely to go get tested, certainly alleviate some of the strain on some sectors by doing that. The risk is that we have still some people will still be infectious after that period. So those are the type of things we're balancing right now, but we're absolutely looking at that.
Thank you. I'm also wondering about bringing healthcare workers early out of isolation back to work. Is that being considered, and what has to be done maybe before that? Would that come after stiffer health restrictions? And how much of a last resort is doing something like that specifically?
So there's a number of things to look at there. So, healthcare workers who have a respiratory illness that are test negative, that are recovering, we have an ability to have them back at work. You've seen some jurisdictions that have, needed to resort in some circumstances that even test positive workers who are recovering may be able to turn. And then your question is how short could we have an isolation period? These are all the questions that are need to be balanced, right? The risk versus benefit. If we are seeing quite a substantial strain due to illness on the healthcare system where we're unable to provide care, then we need to look at these things. We'll certainly do so in the least amount of risk possible. We know we have a highly controlled environment there with PPE, with other frequent tests as well. So we're looking at that, but it's all going to depend on the capacity moving forward.
From City News, Morgan.
Hey, everybody. Thanks so much for the time today. So I was speaking to some folks from the Manitoba Child Care Association, and they were telling me that they felt pretty blindsided by the recent announcement to extend the break for school children here in the province. I'm wondering, what's it looking like in terms of that January 10th return date? At this point in time, are we going to be seeing kids maybe off school for a little bit longer, or are we even having conversations about a return to online learning? What are those conversations, and how are they happening right now?
So, of course, we extended by a couple of days there. We needed to get more time to see what's happening with Omicron. We're seeing those rapid escalation in case counts. And so these are our discussions that are ongoing right now. There's no decisions being made right now. We certainly work with stakeholders, but ultimately we're seeing things change quite quickly. So we may have to pivot, but right now there's no decision made on that.
And for my follow-up, I was speaking to a teacher who said that, they're having sleepless nights about the return to school, that they're not feeling safe, that they're actually saying that they kind of feel like they're expected to be a martyr in this situation, that they're supposed to kind of, as you had said, kind of pivot on a dime. Don't you feel that parents, teachers, and of course childcare providers deserve a little bit more leeway and really an answer on what the plan is? I know that discussions are happening, but can't you give them a little bit more insight into where the kind of government is kind of pointing its direction in terms of that path? Like, are we going to see kids for sure go back to school on January 10th, or are there conversations at this point in time happening to maybe see that extended further? Don't you think that parents and teachers are owed that information?
Yeah, and it would just be great if if this virus would give us that kind of notice, and that we could know exactly what things will look like in a week or two. So that would be great, and I think everyone would like that, and then I think everyone is owed that. But we just can't do that with this virus. Things are changing so quickly. We have to be able to pivot quickly, and that's true for this sector and causes lots of issues. It's true for other sectors, and I'm sure other sectors affected by the recent restrictions we put in would have liked to know them weeks earlier. We just don't know. So we have to deal with what we are dealing with, and this is a highly infectious variant that we're learning about daily. We're seeing rapid changes in a lot of information. So, ideally, we would love to have a solid answer for what 2 weeks from now looks like. We just don't, and so we have to do what we can with this rapidly evolving situation.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. I was wondering, with the Omicron variant now dominant, will you be requiring unvaccinated healthcare workers to be tested daily? And is there any consideration to screening vaccinated healthcare workers?
So these are all type of things we're all always looking at. Specific questions about policies with healthcare workers, probably best directed at shared health at this point. They're all things that we need to consider, but there hasn't been any changes yet.
Okay, thanks. And I did want to follow up on Bart's question about, a circuit breaker or a lockdown. So when we talk about hospitalizations, we say we don't know what the impact will be yet on the system when it comes to Omicron. And some physicians have described this approach as being a gamble. And I'm wondering if you see it as that, in that way as well. Is it worth the risk to not lock down, given that there is so much uncertainty related to hospitalization?
So it's, of course, not a gamble. We wouldn't gamble with Manitoba's health. So the issue is when stated that way is that a lockdown has no negative effects. And of course, a lockdown does have negative effects. So, and we're not going to be speaking harshly against the possibility of a lockdown, because, like we said, things change. So it's certainly possible that we need to take further measures. But right now, we've put these measures in place, and we're going to have to continue to follow things. But again, when we use terms like circuit breakers and things, they sound less severe than a lockdown. But again, in 2 weeks' time, Omicron is still going to be here. So we have to be prepared that when we say lock things down or circuit breaker, that 2 weeks from now or 3 weeks from now, we're still dealing with this variant. So these are real challenging questions. So we need to look at all aspects of it, and we do daily. And so there sure could be further measures taken, but these are not decisions made lightly.
From Global News, Will.
Hey, good afternoon to you both. Dr. Reimer, first question would be for you. I have some parents wondering if the time between doses for kids age 5 to 11 should be shortened due to the risk of contracting Omicron. You want to give us your thoughts on that, please?
Yeah, and the National Advisory Committee on Immunization did a specific re-review of their recommendations after the emergence of the Omicron variant, and they continue to recommend the 8-week interval for kids who are under the age of 12 for a couple of reasons. One being that we know that 8 weeks produces a stronger immune response than 4 weeks and potentially has fewer side effects than 4 weeks. But on top of that, we know that Omicron is going to be around for a little while. And so any benefit that those kids might get in the short term would be at the expense of better longer term protection. And when the kids are already at a lower risk of severe outcomes, not zero risk, we certainly see children ending up in the hospital because of this virus, but at a lower risk, that risk balance becomes a different conversation than it is, especially for older adults. So we're going to, for now, continue to follow NACI's guidance on this, but we will be watching very carefully. And if we do start to see any signs that children are being affected more severely than we expected, we can change that recommendation. But what we're seeing right now is consistent with NACI's advice to stick with the 8-week interval.
Okay, thank you very much for that. Dr. Roussin, rapid tests for teachers, daycare staff, and children themselves. Any plans to make this a reality, and if so, how soon?
Well, I mean, we have been working on expanding access to those rapid test kits. Like we said, we're right now looking at return to school, what that's going to look like, how that will unfold, and so part of that is rapid tests as well. So we don't have any definite plans on that, but that is part of the number of things we're looking at right now as we're thinking about getting the kids back to school.
Okay, thanks.
From the Brandon Sun, Karen.
Good afternoon, everyone. Just to expand a little bit on the teachers and the rapid test kits. Students K-6 are getting these test kits, but teachers aren't. A lot of people are just asking, like, what are the priorities here? Like, the students seem to be the most concerned, but teachers are getting, like, for better or worse, second-class citizen treatment. So your thoughts on that?
Yeah, so remember the purpose of these tests is really to limit the chances of an infectious student returning to class, so that protects other students and the teachers as well. We were targeting some of the younger kids who are just getting access to vaccine now. Teachers have had the opportunity to be fully vaccinated. And then of course we do still have the test sites that are available to symptomatic teachers as well. So it was just a way of targeting those that didn't yet have long access to vaccine, and it's really to protect people coming back to limit the chances that they're infectious when they come back, which protects that whole school community.
Okay, thank you for that. And just maybe a more scientific question, just with all these growing calls to go to red, lockdown, whatever, as doctors, what do you think should be done?
Well, in public health, we make recommendations to government frequently, and the public health team makes recommendations to me, and I'm in contact with a number of stakeholders on here. So I think it's what we need to be done is what we've been discussing. I think that there certainly is a role for public health restrictions. They're certainly necessary, but not sufficient. We need Manitobans on board with what we're doing here, decreasing their contacts, again, isolating when you have symptoms. So there's a number of things there, and with how infectious Omicron is, like we said, we may have to pivot further. So it's a real difficult time right now for Manitobans, seeing these numbers go up, and things like public health restrictions. They'll always be a challenging thing to try to find that right balance.
From CJOB, Rosanna.
Hi, Dr. Roussin. How is the province planning on distributing KN95 masks going forward? And will people like children under 5 and workers in these higher risk settings like daycares get that supply directly instead of through liquor stores?
I don't really have much to share on that. I think maybe we'll give that to our communications team here, see if they can provide anything further for you.
All right, thank you. Switching here, 2 health centers in the Northern Health Region, Gillam Hospital and Leaf Rapids Health Center, have both closed until January because of staffing issues. Any word on giving them the support they need to reopen now?
So that question is going to need to be directed to Shared Health.
From the Winnipeg Sun, James.
Yeah, good afternoon, doctors. Just to follow up on the previous question there with these 2 hospitals closed, how dire is the staffing situation in healthcare settings in Manitoba right now?
So I don't have details on those settings, and I guess for a more specific response, then you'll need to discuss with Shared Health. But what we know, we have sort of that the impact from both sides, right? We have increasing demands on the healthcare system for various reasons, but most notably because of Omicron. And then what we know is just as we're seeing increased number of cases, well, part of those increased cases include healthcare workers, and so that puts extra strain on the staffing. So it is that challenge. It is why we've put in more measures. It's why we're asking Manitobans to do what they can to reduce their contacts. It's why we've pleaded with Manitobans to get vaccinated as soon as they become eligible for another dose.
Dr. Roussin, are you seeing incidental cases of Omicron in people hospitalized for other problems? And are these patients being counted as in hospital due to the new variant?
Yeah, and so right now I don't have any details on that. The way we've reported various hospital admissions is sometimes challenging because we sometimes do see that people admitted for other reasons who may have a COVID infection. But right now, I would say I haven't heard specifics about that, but that's another one that could be directed to Shared Health.
Thank you.
All right, folks, we have time for a few more questions for our doctors. Please proceed.
Yes, I was just wondering, we talked an awful lot about pivoting and sudden changes. Just wondering, I've heard from a few personal care home residents and their families that they've had to suddenly isolate, even though everybody's been vaccinated, and they were told at the time they wouldn't have to isolate if they were brought out for, say, a holiday function. I'm just wondering exactly when did these new isolation orders come through, or is that just a for the individual personal care home?
I can't speak specifically to that situation. That we can direct things to shared health on that, but it's hard to know what the specifics were in that situation.
Dr. Roussin, are you personally leaving your home for any reason other than to get groceries or go to the drugstore?
At this point here now, I'm not doing much for that. I think that I've always mentioned that through the public health restrictions, following those restrictions, if we had Manitobans follow all the things that are outlined in those restrictions, we're going to decrease the risk. I don't find myself heading out too much. A lot of that is just because of the busyness of the situation as well.
Dr. Roussin, could you comment on, whether or not the provincial government is going to be consulting or giving childcare workers more leeway, more time to prepare if you folks are planning to close schools without any sort of immediate change to online learning? Will you make that commitment today to try to give these childcare workers a bit more time, a bit more heads up?
Well, we're committed to doing what we can to keep Manitobans safe and healthy, right? So we're looking at the situation where we're discussing things now. Of course, throughout all of this, our number one concern is the health of Manitobans. We definitely want to be there for the stakeholders and give as much notice for things, but like I said, we have to deal with the variant that's ahead of us. So we're going to just keep looking and come to a decision on what we think is going to be best for Manitobans, and I sure hope that's going to include notice to everyone involved. But these are very, very challenging times.
Dr. Roussin, it's Michelle from CTV. I'm wondering about the King Edward location for testing. We're hearing that it's just rapid tests there. Can you explain what's going on with that?
I think we'll direct that to the communications team and just see what we can get you on that. Our messaging again is that for the most part, those rapid tests we're distributing them to try to decrease the strain on the molecular testing that we've seen, trying to decrease the wait to receive tests, and so we've definitely ramped up the availability of the rapid tests at those sites.
Dr. Roussin, what advice have you received directly from medical officers of health and shared health senior staff regarding further restrictions to protect healthcare at this moment and over the past 2 weeks? What did they advise you to do?
Well, this is the challenge with this. There isn't a one thing to respond to. So you've seen certainly and quite clearly that there's many in the acute care system calling for many more stringent measures. A balanced approach, but we hear on both. I hear from the acute care system people in there restrictions as well. So real challenge. We don't receive a single piece of advice from any sector saying this is what you should do, right? So we have to take a lot of information from a lot of experts in public health and acute care and other stakeholders. And then try to come up with what we think is the best approach, and that changes over time. And then you'll see people on both sides that aren't pleased with where we land.
Here's why I ask this, because in the second wave, we didn't lock it down quickly enough to prevent hundreds of personal care home residents from dying. And in the third wave, we didn't lock down quickly enough to prevent 57 ICU patients from having to be sent out of province, and a third of whom died. So given this history and given this experience, why wait this time?
Well, we didn't wait. We acted very early on a number of our measures. We were out with modeling and put in restrictions. Of course, every time we put in restrictions we hear that they're not enough, and then we hear that they're too much on the side, and then we acted again, and then we'll hear again on this that they're not enough, but then also that they're too much. So yeah, I mean, I think it's challenging, and we're continue to look at these things, daily. But it's to think that it's just a black or white answer on any of these things is simplifying too much.
No one's saying it's black or white, and forgive me, that's not what I'm saying. The restrictions announced that went into place this week were not radically different from the ones that were announced the week previous. Given the mathematics of just an additional handful of additional ICU patients a day, it doesn't look like anything we're doing right now is going to avoid a crisis situation. I'm really happy to be wrong. I'd love it to be wrong, but we've seen this movie before, and I'm wondering why this ending seems to be the inevitable conclusion each time.
Yeah, I don't think it's inevitable. We've messaged that Manitobans, we've never been helpless against this, right? So we do have measures that we can each take. We have measures that businesses can take to reduce the amount of contacts between their employees and patrons. We have a significant amount of Manitobans vaccinated now. With more and more getting vaccinated every day and third doses, and so there's a lot of things being done. So I do think we should be concerned, and we were concerned when we went out on the 17th of December and provided that modeling and implemented measures. We're concerned when we extended those measures, and we're still concerned now, and still watching this daily. And like we said, we may have to pivot quite quickly. That's the nature of this.
Dr. Roussin, it's Michelle from CTV. What is the best metric for people to watch? You said yourself that, the test positivity rate might be skewed because of the rapid test use, and there are the long delays, the 10,000 tests in the queue. So what is the best for people to watch to understand what is happening in the province?
So what I would say is I would preface that by saying the best thing to do is to limit your contacts. Don't change your behavior based on any indicator you see. Right now, we need to limit the amount of contacts we have, and that should be by more than half of what we would normally expect at this point. Follow fundamentals, follow other public health restrictions. Don't change that based on a number you see being reported, because we need that right now. In the, overall, the most important numbers have always been that strain on the healthcare system, right? So hospital admissions, ICU admissions. Of course, the problem with that is that those are lagging indicators. So, so I think right now that message is don't change your actions based on test positivity or on case counts. Just change your actions now to decrease the amount of contacts you have.
Hi, it's Dylan from the Winnipeg Free Press. Dr. Roussin, can you please clarify your comments about not being able to reach people who got a test and then they tested positive? Because I think most people use cell phones, so they wouldn't have the landline ringing. Can you clarify if you use text messages and what percentage of people are not actually picking up the phone?
Yeah, and so I mean, people leave their contact number that they want to be reached at, right? And then so I mean, people who are going for testing should be isolating while waiting for the results. So it shouldn't really be difficult to try to get a hold of people. You're right. There might be a proportion of those people that just don't answer their phone. They're at home isolating, but we've seen a higher proportion of that. And then that varies a lot. I think that early last week I heard that in certain areas is up to a third of people were having difficulty trying to get a hold of. And so ultimately the message there is that all those people who are going for testing, you should be isolating pending your results.
Thank you. And if I could ask about the clinical guidance when it comes to rapid tests, the updated December 20th clinical guidance has new measures in terms of who needs to isolate. I'm just wondering how much of that relates to the PCR test, and if someone has a positive rapid antigen test, if it's the exact same expectations for the household contacts and who needs to isolate.
So, so right now the guidance is if you test positive with the rapid antigen test, you should return for the PCR test. So, of course, that's going to have that delay. So, the messaging right now, given the amount of transmission we're seeing, can be simplified, right? It says if you're ill, you should be isolating pending test results. If those test results aren't going to be forthcoming because you're not going for testing, then you need to isolate as if you had COVID, and that should be 10 days. And you should inform your contacts and household contacts accordingly. If you test positive for a rapid antigen test, you should return for PCR. Of course, you should be isolating pending that result. If you're not returning for that PCR, then you should isolate as if that was a confirmed PCR, which is 10 days, informing your contacts that you tested positive, and they should be isolating as well.
For a couple more questions, folks.
Hi, Dr.
Okay,
Hi, Dr. Roussin here with Rosanna with CJOB here. We're seeing the number of kids hospitalizations spike in other jurisdictions. What's that looking like here? Like, how many Manitoba children sick with COVID are in hospital and in ICU?
I don't have details on those numbers, but we haven't seen a significant spike in pediatric admissions at this point. But again, Shared Health will be able to provide the details on that.
Okay, and just for scientific purposes, there's an awful lot of information out there from supposed studies about how Omicron behaves, and it's way more contagious, but seemingly less lethal, and the mutations make it harder for it to replicate inside the upper respiratory tract. I know a lot of people out there are wondering how they should be taking this kind of information.
So, I mean, right now the message is we need to decrease the transmission of this virus. It's a lot of evidence is showing that it is likely to be less severe, but it's nowhere enough less severe to not put enough strain on our system, right? So we have numbers that we've never seen before. So even if it's substantially less severe, the overall strains on the healthcare system are still going to be too great for us to handle. New information is emerging all the time, so we need to continue to learn from this. But we can in no way rely on the possibility that this is less severe. We need to decrease transmission, and we need to decrease that transmission now and significantly.
Hi, Rosanna here with CJOB again. With the high number of breakthrough cases, are you considering changing the definition of fully vaccinated anytime soon?
So we don't have a specific recommendation on that, but just like any other steps we take, we will do it for the best interest of the overall health of Manitobans. The advice is very, very clear. Get whatever dose you're eligible for as soon as possible. We know that being fully vaccinated still has significant protection against severe outcomes, even with Omicron. We know that third dose provides even better protection. Right now, the message is quite clear that we need all Manitobans to get whatever vaccine they are eligible for as soon as possible.
Thank you, doctors. Thank you, everyone. This concludes our Zoom session.